Okay, so for our medical moment today, we're going to talk about a kitty cat that was limping. We had a client bring their young kitty cat, year-and-a-half-old kitty, in because he was limping. And Dr. Stevens wisely recommended that we take an x-ray. And when we took the x-ray, we found this image up here. And if you look closely, you'll notice that these two hips are not like each other. On this side, on the pet's left side, you see a nice deep socket on the pelvis with a nice round ball, and the ball is fitting deeply in the socket so it can turn nice and smooth and even. This kitty was limping on its right rear leg, and when you moved its hip, number one, he said no thank you, and number two, you could actually feel grinding in his hip joint. And it turns out that the grinding was because the bone that bridges from the femur, from the leg, the thigh bone, to the socket, which is the ball, the head of the femur in the acetabulum. That bone going across there, as you can see, is very slender and small and skinny. And in fact, it had broken. The bone had broken just while this kitty was walking around. Now, that bone did not get like that suddenly, though the cat started limping suddenly. That bone deteriorated over time because it lost its blood supply. And sometimes the blood supply is interrupted during development while they're growing, when they're young, teenage year kittens, so when they're, between 4 and 10 months of age, that kind of thing. But the result is the bone's unhealthy, it's very fragile, and they can simply step off the couch and they can break their own hip joint. Sometimes this sort of a change to the bone follows some big injury where there was some impact. In this case, there was no history of that, so we think it was more of a developmental situation. But regardless, the cat now has essentially a broken hip. And when bones wiggle, it hurts. And so the goal is to help this kitty not be in pain. And there are several things you might try and do. You might try to encourage the bones to heal, but since the blood supply is lacking, that wouldn't work very well. You think about a bone graft or something like that, but even a bone graft would require a good blood supply, and this kitty just doesn't have a good blood supply to that part of its bone. You could think about doing a hip replacement surgery. If grandma has a bad hip and she slips and breaks her hip, people get hip replacement surgeries all the time. It turns out that large animals, dogs over 40 pounds, frequently get hip replacements as well. Technically, it's very rare and difficult to do the surgery on this size animal. I don't know if they even make hips small enough for a pet this small. They might, but I doubt it. And the reason is because it turns out you don't have to. Since the goal is to avoid pain, and the pain is being caused by bones that are rubbing next to each other, if we can make it so there is no bone rubbing on bone, this pet's going to feel better. And so there is a surgery, and that's what we did on this kitty. I don't have the post-op film of our particular patient, but this is a sample from the internet of what this kitty looked like after the surgery. And essentially what we did is we removed the bone from the neck of the femur, we removed the head, and then I did a procedure where I took a bit of muscle from the biceps and wrapped it around the cut surface of the bone. The net effect is, and the term for that is a femoral head ostectomy. So FHO is the name of the procedure. Now there's no bone touching bone, so the pain is gone. Now, this kitty is going to form scar tissue at my surgery site, and it turns out that since it's a cat who weighs 10 pounds, scar tissue is plenty strong enough for this kitty to be able to walk and run around and use its leg just fine. Technically, if you were to measure, you might find that the one leg is slightly shorter than the other, but in reality, mobility-wise, these patients, the small patients who have an FHO, they tend to do great post-operatively. This kitty was just in to have its pain patch removed and staples out, and he's already running around, tearing around, trying to jump off the bed. So he's feeling great, and he's going to do just fine.
How old is the cat?
Year and a half. Yeah, youngster. Any questions? So that's an FHO. We can do that. We did this in a kitty. We could do it in small breed dogs. I have on rare occasion done it in large dogs. It's not a recommended treatment, but as a salvage surgery for a dog who's super painful and the client doesn't have the funds to do a hip replacement, it can be done in large breed dogs as well, though it's not the first recommendation. That's the scoop.